Hello, and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I am joined by my friend and also Read Scholar, Dr. Kimberly Cauley Narain, who is an internal medicine physician, a health services researcher, and a recent author. She recently published a children's book, The Cycle of a Dream, A Kid's Introduction to Structural Racism in America. Hi, Kim, how are you?
Hi, Mary. Thank you for having me.
So, how are things? How do things find you on the West Coast?
It busy, still trying to adjust to this new COVID normal, with life, managing kids, managing job. It just seems to never stop, but I'm doing good. We're all healthy, so I don't have any complaints.
That is good. I mean, if you can get out of 2020 with no complaints, we are doing well, right?
Right.
So I usually like to start with a little bit of your backstory. So tell us what led you to medicine, what led you to internal medicine specifically, and then we'll kind of go from there.
Yeah, so I came at this as a patient. So I have been diagnosed with Crohn's disease since I was 14 years old. So I saw sort of firsthand the significant impact that quality medical care could have on somebody's life. And I essentially set my sights on, doing that for somebody else, very, very young. And went to UCLA for undergrad, and then just sort of happened in a African American studies course as one of my liberal arts requirements, and essentially fell in love. So much so that I ended up doing both a microbiology and an African American studies major. And it just really kind of changed the trajectory where I was still very passionate about medicine and health, but wanting to think much more broadly about how sort of societal circumstances impact somebody's ability to be healthy. And so that's, I feel like, the starting point, of where I am now and the direction that my career took.
So for our listeners, so in addition to just being, not just, but being a Read Scholar, Kim and I are cohorts. So we were in the same class. And so we kind of went through part of our health equity journey together. So tell us a little bit about that transition for you, because I think, for Read Scholars, all of us know that year was pivotal and how that changed the trajectory of our careers. But tell us a little bit about that year, and then what made you, how did that propel your next step?
Yeah, so, I'll go back to residency. So this, passion for, wanting to think about broader sort of public health problems was really ignited. And that was further cemented just by my interactions with patients there. So dealt with a lot of patients, had a lot of chronic disease, and, feeling ill prepared to really change their circumstances in a way that will allow them to be healthy. And just knowing my passion and my interest, some of my program directors highlighted our, Read Scholar Fellowship, as something that they think would be, a good fit for me. Right. And I applied, fortunately got in, and really that was the first, opportunity that I had to really, be immersed in, sort of thinking about social determinants of health, thinking about, policies and how that can be leveraged, to improve health outcomes. And I had really thought, okay, I want to be a policy person. I am going to go and, fight for these policies. But, as I started to learn more about where we were in terms of the literature, it dawned on me that there was still, much more to investigate with respect
Mm,
to, figuring out exactly what were the optimal policies,
mhm,
as far as improving health outcomes for underserved and under-resourced populations. And so I figured, okay, well, then I'm gonna start doing some of that work too. So I have finished, you know, the Reed Scholar Fellowship, and then went right into a Robert Wood Johnson Clinical Scholar Fellowship, which focused on health services research. And one of the first things that I did was sort of think about, what are, sort of broad social policies that need to be studied in terms of
mhm.
the health implications. And then I started to study, welfare reform. So I don't know if, the audience will be very familiar, but um, these were Clinton era changes which implemented actually work requirements.
Right.
We'll now be very familiar with that in the context of like Medicaid, but that was actually where those ideas really became popularized. So work requirements, time limits, so I really started, doing some studies looking at the implications of those policy changes for health outcomes among single mothers with low levels of education, and finding increases in self-reported disability, self-reported poor health, associated with these policies. And I've just really been sort of passionate about, you know, um, doing that type of work ever since. So I've done some analyses looking at the implications of changes in minimum wage laws
Mm,
for, access to care and health outcomes and health behaviors across race and gender. I've also looked at just recently implications of state level earned income tax level generosity for HIV risk behaviors among women.
mhm.
Um, yeah. And so those are some of the things that I've been focused on. Just recently, I actually got NIH funding through a KOA grant to study the implications of value-based insurance design,
Mm,
essentially the provision of medications and doctor's visits at no cost for individuals with low incomes who are diabetic, just to think about what are the implications of, just removing that cost burden for control of their, risk factors, for poor cardiovascular outcomes. Um, and so, yeah, I'll be focused on that, doing some statistical modeling, some microsimulation modeling as well, to think about what are the long-term and short-term implications of policies like that for health disparities.
So, we could do a whole podcast just on these things, especially, I mean, and like literally everything that you just said was highlighted in 2020 with the COVID pandemic, right? When we talk about, everything everything that's been related to the essential workers and that patient population, and these policies that have affected how that population works, how that population is compensated, how that population is insured. You just kind of went through all of those, and that's just a subset of the population. But we can see how the pandemic has underscored and highlighted these vulnerable populations, and then also highlighted these policies that make them especially vulnerable during things like this. But I really want to talk about your book. So we'll pivot just a little bit, and we'll get to some of those. I mean, some of those things are still kind of highlighted in that structure. So we talk about 2020, we're talking about the pandemic, we're talking about the essential worker. And so in the midst of all of that, we have this kind of social justice uprising that happened in the US, and not just in the US. I mean, it's clearly a global issue. And so a few of the events that have been highlighted over the year, and there have been many, but I think, George Floyd's death or murder, if you will, was definitely a pivotal point, in addition to Breonna Taylor and others that happened in the spring, and trying to understand what that means for Americans in general, what that means, specifically for Black Americans, specifically Black women, but then also how do we explain this to our children, right? And so And I know that that's kind of what drove you to this book. So give us a little bit about um, what prompted it and then kind of the evolution of the project.
Yeah, I mean, so you highlighted a lot of what compelled me to write this book. So I have a 7-year-old daughter, and was just really struggling trying to find a resource to help me, explain what she was seeing in the environment around us. So all the protest, and to help her understand how something like George Floyd could happen in her lifetime. And, what I found in talking to her is, based on what she had learned thus far, with her curriculum, she really had the sense of the struggle for civil rights was over. A direct quote that I'll share with you, when we were talking about sort of segregation, was that she said to me, "Well, I'm so glad Martin Luther King solved racism." And it kind of dawned on me that because of how it's taught, particularly in K through 12 education, or how civil rights is taught specifically, is a lot of adults have that impression too. So, I just thought, okay, I've got to do something, to help give her an understanding of how what she learned about, in studying Martin Luther King and so forth, is really relevant today. So that's essentially where I came up with the title, because anybody can tell you about, the I Have a Dream speech,
Right.
anybody in the street, but they can't really talk to you about what happened after that, so hence we come up with, the cycle of a dream. So we can talk about where, we are, what led Martin Luther King to have a dream in the first place.
Right.
And then, where are we after the dream, or after the I Have a Dream speech, and just sort of taking a stock, of that, and then thinking about what needs to be done moving forward. So in terms of, writing the book, I just, pulled some resources, I wanted to not go past the evidence, and not try to exaggerate, and didn't want to traumatize kids, this is for my own kids,
Right.
so it's like, how do you break down these facts into small digestible chunks for kids, so I pulled some key events, in the trajectory of our experience in this country, and just try to bring it down as low as I could, so my 7-year-old could actually understand it and make sense of it. And that's what I did. And once I got a draft together, I reached out. I'm an academic by heart, so I always want to know,
Right.
what are the people that have been studying these issues their whole lives saying about what I'm doing? What are they thinking about what I'm doing? I just have that respect, for people and their expertise. I came at this as a parent. I am a internist. I do not do PE. So I read.
Like me, I hand the baby off and then you work that out.
Everybody I see can fly.
Exactly. We stay in our lane. Yes.
Yes, yes. So I reached out to, my peers, friends and colleagues, who have been thinking about these issues, particularly our own Dr. Reed, who is a pediatrician, but not only a pediatrician, has child psychiatry background as well.
Right.
Yes. So my main question for her was, will this traumatize a kid? And she thought, that it was extremely important and valuable work, so I kind of breathed a sigh of relief once I saw that. I reached out to, our own Dr. Ashanta Tumblin, who has been thinking about racial socialization of young kids for more than 10 years. I reached out to another friend and colleague of mine, Daniel Cosman, who is a assistant dean of diversity, equity, and inclusion for the David Geffen School of Medicine. And then some of the most brilliant self-taught historians I know, my husband, Mark Narain, and then my brother, Thomas Cauley. And so once I heard back from all of them, and they gave me kind of the green light, I thought, okay, I'm ready to go. So then I started sort of inquiring about finding illustrators, and reached out to our own Dr. Christina Rosenthal, who wrote her children's book that deals with, helping children visualize themselves in the medical profession, and asked her, for any resources that she could offer. And she linked me with the Mike Mott's group, who actually works with various illustrators of all types. And you can essentially select an illustrator from their page and then work with them to develop illustrations that essentially encapsulate, what you want to say, and you just kind of, it's a very iterative process where you're just going back and forth, that's not right, that's right, but this thing's not right. I went as far, even in some instances, as, sending a photograph, like, do this.
This is what I see. Yes.
Yeah, this is what I see here. But it just really challenges you to think about how you can go from, something abstract like the wealth gap, and translate that into something concrete on a page, that a 7-year-old can understand. Yeah. And essentially, did that. So you pay by the illustration, so there was a lot of sort of cutting down too to figure out, what was the absolute. So I credit that with, making me be probably a little less verbose than I would have otherwise been.
Gave you a little structure, yes.
Exactly. So I was like, how can I say what I need to say in the fewest illustrations possible? But hey, that worked wonders for readability. But that was a separate package. So I dealt with them for the illustrations, but they will also essentially put together your product so it's ready to go for self-publishing. So I, had them put together, that product. So it was ready for them just to upload on Amazon. So.
And just to go back a step and underscore what you said about the process and being creative and informative, and not scaring the children, right? So creating a product that is history driven, but also doesn't scare kids to make it seem like that it's unsurmountable, right? So, we've gone through this, we're going through this, but we can get through this, right? And thinking about, kind of even the evolution of I guess our coming to age story. So, police brutality is not new, right? And it's not new in media. And thinking about, rap groups like NWA, if we're going to talk about the West Coast, we talk about movies like Boys in the Hood, like when we were growing up and seeing it on the screen and hearing it in popular music, and then thinking, let's not say how many years we are from that, but yet we're fighting with the same issues. And so now we have a new group of young people who are growing up trying to wrap their mind around that. So I say all of to say, where do you think we go from here? So you've created this for, our elementary school kids, but they're gonna evolve with this. So how do you continue the conversation to the middle schoolers and the high schoolers and those who, we had Barack Obama who was president, and then we were supposed to be post-racial. We were on this great place, right? But clearly that was not the truth, and we knew it wasn't the truth in real time. But they didn't get that sense. So how do you grow with the conversation? Where do you think we kind of go from here as they age?
Yeah, I've been thinking, quite a lot about like where to start. So, I've been doing, a lot more in-depth, review of, individuals that have actually sort of published on this area and, what they're saying about sort of the right time to initiate, these sorts of conversations. And come to find out, they feel like 7 is an optimal age. I'll just highlight this content review of all second grade textbooks that was done by Mary Fesperman. It was part of a dissertation project. And so I want to say she didn't do all of it. She did 3 of the 4 most popular textbooks, social studies textbooks for second graders. This has something like 90% of the market share.
Wow.
And why she did that is because based on various developmental theorists, 7 is really the optimal age. Why? Because kids are, aware of stereotypes. Apparently by that age, we think they're not picking up anything, but they can identify what stereotypes go to which groups with like 70% accuracy. They are thinking about, who's in their in group, who's in their, out group. They take pride in being in certain in groups. They are also, though, developing their own identity and moral compass. And they have the critical thinking skills where they can actually challenge, what's being fed to them if they're provided with the right information. Whereas the older you get, even as early as like 9, 10, a lot of those stereotypical racist views are heavily cemented. So if you really want to make, it makes all the sense in the world, right? If you really want to start to, challenge these ideas in a substantive way, the important, aspect of that is doing it as early, as possible. Because we think if we don't discuss it, kids don't see it, but kids realize only certain people of a certain skin color are in their neighborhood,
right.
Or, there's more people of a certain, skin color in a certain profession than others. And when we don't actually talk about it, they fill in them gaps for themselves. So do we want them to have those gaps with misinformation? Or, do we want them to be, well-intentioned, and well-informed? And, if you think about kind of the way that the textbooks are actually operating, and it was just, beautiful, the analysis she did, a pictorial analysis. So she's looking at, who's shown as a professional versus who's shown as a stereotype. Are we showing, segregation in the images in these books? So something like 2/3 of, pictures with, multiple people, more than one person, was like a segregated image, like white, people were not shown together across racial groups. Who were the heroes, who were the victims, who elicited empathy. It was all in a way to sort of reinforce the dominant narrative,
Right.
that civil rights is kind of over and this is the land of opportunity, of liberty, freedom. She did a count of how many times, words like liberty and freedom and justice were mentioned. Liberty was, mentioned, something like 70 times, whereas in these books, words racism were not mentioned at all. 0. So,
Yeah.
And the beautiful thing I think about this book is I've gotten so many messages, from parents, white parents who have said, oh, I learned so much from this book, and now, I'm going to share it with my kids. So I said, oh, wow, it's actually a parent's introduction to structural racism as well. But, I think it's so tough, as a parent to just, be getting exposed to this stuff because you're so ingrained in your life, your patterns are so set, to really deviate from that in a substantive way becomes much more challenging,
Right.
than it is for kids who are actually thinking about who they are or who they want to be in the world as they grow. So I think that is really, the place to start. And like I said, as I read, more and more people who have actually studied this, that is really the way that they're saying, to go. So I see this book as really sort of assisting with that racial socialization, process. Because whether we, do it directly or not, we are doing it. So when we do passive socialization, so we don't talk about it at all, we let society stand in and do it, and kids will come to their conclusion, and those conclusions are, more often than not, you know um, racist conclusions, just based on the structure of the society,
Right.
and if you do this egalitarian socialization, which a lot of people do, which, may be very well intentioned, this, everybody is created equal, and you don't discuss racism, once again, kids are logical, and they'll say, okay, if everybody has, the same opportunities, and one group is so much, more, just essentially so much more disadvantaged, then it must be their fault. So they come up with that, you know. And then I'll say, this is not new information. I think a lot of Black people have been engaging in this type of socialization as a matter of survival. You need to equip, your kids to, navigate in this world. You need to give them skills that will protect them, so they've been kind of figuring this out on the fly, so I believe it is something for all comers, because it gives them a way to, share this information with their kids as well. And then, like I said, there's intersections, Black people are not monolithic.
Right.
I've got sort of two different objectives for my kids. Yes, they will, probably be subject to, various stereotypes, but they will never, know what it is to have been raised with material lack, right? I'm a professional, my husband is a professional, they don't know what that means. So how do I, essentially provide them with the information that, lets them know that they're very privileged and very fortunate in some other ways, exactly. And, because they have certain advantages, it doesn't mean you go on and you live a good life and you're divorced from all these other people that have not been as fortunate. It means you take the platform that you have and that you've been given and figure out how to create opportunities for other people, so kind of works in multiple ways. Right?
Definitely. So as we close, I know we don't want to keep you too long. And even though that was quite a, I think that was quite profound and an important place to. And that's not where I want to end, but I do, I do want people to make sure that they heard that, and that there are those who are trying to figure out what this balance is between making sure that the children that we're raising, this collective children, right, the children that we are raising, understand the struggle, um, understand their privilege, and also understand how to be purposeful and contributors to the society at large. So trying to put all those things together is just easier. I don't even know if it's easier said than done. It's not even easy to say. But as we close, though, I usually like to end on an optimistic note. And so tell us what you're looking forward to in 2021, as we hopefully have learned a lot from 2020. We've dealt with a lot of grief, we've dealt with a lot of unpredictability, but we've also had the opportunity to be innovative and creative, right? Like out of this year, I've born things like your book, which are going to help the society at large. Like you said, the kids and the parents, right? Everybody's going to learn from this. So tell us a little bit about what you're looking forward to going forward.
Yeah, I'll keep with the theme of the book. I have been very encouraged by the response, of parents across race, just wanting to essentially use what they've learned to, take strides in their lives and help, children take strides in their lives to start to try to remedy, some of these inequities in their own small ways, right? It takes a collective effort, not everybody doing such big things,
Right.
so I'm looking forward to spreading that message, more broadly. So we've got a couple of, big promotional things on the horizon, next year. So I am, very interested in sort of disseminating this message and seeing where it can go. Essentially, I'll just do a shout. There are no national standards for talking about race or racism whatsoever. So it's kind of the wild west.
Yeah.
All across the country, so we have got a lot of ground to cover, as far as trying to get everybody, or everyone that's willing, on the same page with respect to what are the facts of our experience. And once we have a critical mass of people that just actually are aware of the facts, I think we can start to really think about how to move forward on a grand scale, in a way that is really, really profound.
I like it. That is a great place to end. I am, as always, impressed by you and your drive and your intellect and your, just all of, you're just one of those people who I feel like are an all around person, right? Like you can do all the things, and I appreciate that you are so well balanced and you stay true to yourself and your family. But you are also a great academician and clinician. So I appreciate you for all of those things.
And that means so much to me, coming from the person that does all the things, literally. Podcaster, president of an organization, traveling doctor.
Small details. But it's been lovely catching up with you, and I'll talk to you soon.
Lovely catching up with you as well. Mwah.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.